Hemorrhoids. It's a term that might make you feel a bit uneasy, but it's important to talk about it openly. Hemorrhoids are surprisingly common. They affect millions of people around the world, regardless of age, gender, or lifestyle. In fact, many people experience them at some point in their lives. It's estimated that about 75% of people will have hemorrhoids at some point in their lives. The good news: hemorrhoids are often easily treatable. With the right approach, you can manage the symptoms effectively and get back to your normal life. This video is here to help you understand hemorrhoids. We'll provide you with the information you need to recognize the symptoms and seek appropriate treatment. We'll discuss their causes, symptoms, and treatments. From dietary changes to medical procedures, there are various ways to address this condition. By understanding hemorrhoids, you can take proactive steps to prevent and treat them effectively. Hemorrhoids, also known as piles, are swollen veins located in the lower rectum and anus, similar to varicose veins. They can develop internally within the rectum or externally around the anus. And yes, they can be as uncomfortable as they sound. Internal hemorrhoids are usually hidden inside the rectum, so you might not even know they're there. But if you strain during bowel movements, they can cause painless bleeding or even prolapse, which means they push through the anal opening. This bleeding is usually bright red and can be quite startling. In some cases, internal hemorrhoids can also cause a feeling of fullness or pressure in the rectum, which can be uncomfortable. You might notice bright red blood on your toilet paper or in the toilet bowl. This is one of the most common symptoms of internal hemorrhoids. The bleeding is typically not severe, but it can be persistent and may cause anxiety for those experiencing it. While this can be alarming, it's important to remember that internal hemorrhoids are rarely serious. They are a common condition and can often be managed with simple lifestyle changes and over-the-counter treatments. However, it's always a good idea to consult with a healthcare provider if you have any concerns. Any rectal bleeding should be evaluated by a doctor to rule out other conditions. There are other potential causes of rectal bleeding, such as anal fissures, colorectal polyps, or even colorectal cancer. A doctor can perform a thorough examination and recommend appropriate tests to determine the cause of the bleeding and the best course of treatment. External hemorrhoids, on the other hand, are right under the skin around your anus. These are the ones you can often feel. They might feel like small, tender lumps. External hemorrhoids can cause itching, irritation, and pain, especially during bowel movements or sitting. In some cases, they can even bleed. Sometimes, a blood clot can form within an external hemorrhoid. This occurs when blood pools in the vein, causing it to swell and form a clot. This condition is not only uncomfortable, but can also be quite alarming for those experiencing it for the first time. This is known as a thrombosed hemorrhoid. Thrombosed hemorrhoids are essentially external hemorrhoids that have developed a blood clot within them. This clot can cause significant pain and swelling, making everyday activities challenging. Thrombosed hemorrhoids are quite painful and require prompt medical attention. The pain can be intense and persistent, often described as a constant throbbing or sharp sensation that doesn't go away easily. This can make sitting, walking, and even lying down uncomfortable. You might notice a hard, bluish lump near your anus. This lump is the blood clot itself, and it can be tender to the touch. The area around the lump may also be swollen and inflamed, adding to the discomfort. The pain is often described as sharp and throbbing. It can come on suddenly and may be accompanied by other symptoms such as itching, swelling, and even bleeding. The severity of the pain can vary, but it often requires medical intervention to alleviate. If you suspect a thrombosed hemorrhoid, don't delay seeking medical help. Early treatment can prevent complications and provide relief from the intense pain. Medical professionals can offer various treatments, from pain relief medications to minor surgical procedures, to remove the clot and reduce swelling. Remember, prompt attention can make a significant difference in your comfort and recovery. Hemorrhoids are often caused by increased pressure on the veins in the lower rectum. This pressure can be caused by a variety of factors. Common culprits include straining during bowel movements, chronic constipation or diarrhea, pregnancy, obesity, and even aging. As we age, the tissues supporting these veins can weaken, making us more prone to hemorrhoids. Certain factors can increase your risk of developing hemorrhoids. These include a low-fiber diet, prolonged sitting, heavy lifting, and genetics. The good news is that many of these risk factors are modifiable. By making simple lifestyle changes, you can significantly reduce your chances of developing hemorrhoids. The best way to manage hemorrhoids is to prevent them in the first place. Simple lifestyle changes can make a big difference. Eat a high-fiber diet, drink plenty of water, exercise regularly, and avoid straining during bowel movements. Also avoid sitting for too long, especially on the toilet, and consider fiber supplements if you're not getting enough in your diet. These steps can help keep your digestive system healthy and prevent hemorrhoids. While most hemorrhoids are not serious, they can sometimes lead to complications. These complications include excessive bleeding, anemia, strangulated hemorrhoids, where the blood supply to the hemorrhoid is cut off, and infections. It's crucial to seek medical attention if you experience severe pain, bleeding, or other concerning symptoms. When it comes to diagnosing hemorrhoids, your doctor may be able to spot external hemorrhoids with a simple visual exam. For internal hemorrhoids, the process is a bit more involved. First, there's the digital examination. Your doctor will insert a gloved, lubricated finger into your rectum to check for any abnormalities, like growths. Next is the visual inspection. Since internal hemorrhoids are often too soft to detect through touch alone, your provider might use a specialized tool, such as an anoscope, proctoscope, or sigmoidoscope, to get a closer look at the lower part of your colon and rectum. In some cases, your healthcare provider might recommend a colonoscopy to examine your entire colon, especially if your symptoms suggest another digestive disorder, if you have risk factors for colorectal cancer, or if you're middle-aged and haven't had a recent colonoscopy. These diagnostic steps help your doctor get a clear picture of what's going on and determine the best course of action for your treatment. You can alleviate the mild pain, swelling, and inflammation of hemorrhoids with simple home treatments. Incorporate more high-fiber foods into your diet. This will soften your stool and increase its bulk, making it easier to pass and reducing the need to strain. Be sure to add fiber gradually to avoid gas. Apply over-the-counter hemorrhoid creams or suppositories containing hydrocortisone. You can also use pads infused with witch hazel or a numbing agent for additional relief. Regularly soak the affected area in warm water for 10 to 15 minutes, 2 to 3 times daily. A sitz bath, which fits over the toilet, can be especially convenient for this purpose. Take oral pain relievers. Temporarily use pain relievers like acetaminophen, aspirin, or ibuprofen to help manage discomfort. With these treatments, most hemorrhoid symptoms typically clear up within a week. However, if you're not feeling better by then, it's important to check in with your doctor. And if you experience severe pain or bleeding at any point, don't wait. Reach out to your doctor immediately. If you're dealing with persistent bleeding or particularly painful hemorrhoids, your doctor might suggest one of several minimally invasive procedures. These treatments are typically done in the provider's office or an outpatient setting and usually don't require anesthesia. One option is rubber band ligation. In this procedure, your doctor places 1 or 2 tiny rubber bands around the base of an internal hemorrhoid, cutting off its blood supply. Within a week, the hemorrhoid shrivels up and falls off. While this can be an effective treatment, it might cause some discomfort and bleeding, usually starting 2 to 4 days after the procedure. Although serious complications are rare, they can happen. Another method is sclerotherapy, where a chemical solution is injected directly into the hemorrhoid to shrink it. This procedure causes little to no pain, but it may be less effective than rubber band ligation. Lastly, coagulation techniques use laser, infrared light, or heat to treat small, bleeding internal hemorrhoids. These methods cause the hemorrhoids to harden and shrink, with minimal discomfort and few side effects. Each of these treatments offers a different approach to managing hemorrhoids, so it's essential to discuss with your doctor which option is best for you. Most people with hemorrhoids won't need surgery, but in some cases, it may be necessary. If other treatments haven't been effective, or if you have particularly large hemorrhoids, your doctor might suggest one of the following surgical options. First, there's hemorrhoid removal, also known as a hemorrhoidectomy. In this procedure, your surgeon removes the excess tissue that's causing the bleeding. This surgery can be performed using a variety of techniques and may involve a local anesthetic combined with a sedative to help you relax. In some cases, spinal or general anesthesia may be used. A hemorrhoidectomy is the most effective and comprehensive way to treat severe or recurring hemorrhoids. However, it can come with some complications, such as temporary difficulty urinating, which might lead to urinary tract infections, especially if spinal anesthesia is used. Most people experience some pain after the procedure, but this can usually be managed with medication, and soaking in a warm bath can also provide relief. Another option is hemorrhoid stapling, or stapled hemorrhoidopexy. This procedure cuts off blood flow to the hemorrhoidal tissue and is typically used for internal hemorrhoids. While stapling usually causes less pain than a hemorrhoidectomy and allows for a quicker return to your normal activities, it does come with a higher risk of hemorrhoids returning and a condition called rectal prolapse, where part of the rectum pushes through the anus. Stapling can also lead to complications like bleeding, difficulty emptying the bladder, and pain. In rare cases, it may even result in a serious infection known as sepsis. It's crucial to discuss all your options with your doctor to determine the best treatment plan for you. Hemorrhoids might not be the most glamorous topic, but it's an important one. Thanks for sticking with us today. Hopefully you found this information helpful. If you did, don't forget to like, subscribe, and hit that notification bell so you never miss out on our latest video. And as always, if you have any questions or personal experiences to share, drop them in the comments below. We'd love to hear from you. Take care, and we'll see you in the next video.